All right, so we'll seat our patient and get him in the middle of the table. You don't want to have the foot off the table, so you need to put him in a place where that's going to happen once they're there. We'll go ahead and lay him on your side and straighten your body up. We're going to start with the appropriate side up. His left side is up. We want to bring him to the front third or front half of the table, okay? So go ahead and bring your hips forward and your shoulder right on forward, okay? You want them on the front half to front third of the table. Body is straight, so straighten that knee. Foot should be off the table just a little bit. We can bend this knee for balance. So the foot's off the table, body is straight. We're going to tuck this lower shoulder down, just like that. Now there's multiple ways to do it. Tuck it down like that, lift your head. So the body, we got the appropriate side up. Body is straight, foot's off the table. Got him on the front third to front half of the table because that's where I'm going to be working with him. We'll take the top hand and lay it over the wrist of the lower hand. That'll hold this hand in place. If you do it the other way, when you roll the patient up and tell them to relax, guess where this hand winds up? It'll hit you right in the crotch. You don't want that. The top end over bottom hand, that also opens what I call the outrigger. This is opened up. This opens the shoulder, which is where the heel of my hand is going to go. It's going to fit right into that hollow of the deltopectoral groove. I'm going to grip the deltoid with my fingers here, and this is going to wind up tractioning toward his ear. That's the direction that goes. Appropriate side's up, body is straight, foot's off the table, front third to front half of the table. I've got just the right amount of beach front. Beach front is the space between his shoulders and the front of the table. I need enough in this case to roll them forward into position a little bit. So a couple, 2-3 inches is usually sufficient. And you'll notice, I'm going to just demonstrate something for you. You can try this with your patients when you're practicing. I can roll him forward, and he's going to get a little nervous because he feel like he's falling on the floor. But my leg's right here, and I think it outweighs him. So I'm going to roll him up, and I can roll him almost parallel to the floor, and I have very little effort to keep him on the table. That means he's properly balanced. You can do that to show the patients how well on the table they're positioned if you want. I usually do it once, and then I don't do it again, just to show them. But if you can't do that, something's not right. You might be losing their foot off the table or their shoulders. So, once I get them in position, I'm going to start knee to knee. See, this knee is right here, right along there. The benefit to that is I'll be able to hold it in place. I can move things around. If I'm trying to do an ilium adjustment, I'm going to feel the joint. I pick his ankle up off of his leg. See, I'm going to grip it like this. And I can move that knee. That's where the PSI has started to move. I don't want to push it any further back if I'm doing a PI. So whatever you're working on, when it's in the right spot, and then in this case it's just started to wiggle, that means it's neutral. If I'm doing an AS contact down here, when the tissue starts to tension, see, I can feel the muscles tighten right there. That means it's in basically a neutral position, real close to it. So now that I got the patient where I want him, everything moves up. Knee moves up, the little Elvis there, like you. Hands move up, this goes to the shoulder, this goes to your contact. Don't climb aboard. I'm going to move this leg so that I'm within about an inch of the table. I can actually put my knee against the table a little bit if I need to. But for push adjustments, we really don't do that. Roll the patient. You'll notice I'm not touching him with my thigh yet. Roll the patient to the position you want him. Shift your weight to your front leg. I am now holding him with my thigh. And that's the direction the thrust, the counter thrust, the stabilization is going to go. This is what I'm doing with my body right here. I'm holding the thigh in place while I set the pelvis that way. They're going to go toward each other like that. You roll him up, shift your weight to your front leg. I can take that foot off the floor whenever I want. Body weight's up and behind here. Tension the head, the shoulder toward the head. And we'll let the torso fall a little bit. I'm going to catch myself on my contact. My focus is on dropping onto that point right there where my hand is. So that's a push adjustment.